Good morning, everyone. First, I want to express my deepest gratitude to each of our directors, counselors, leadership team, and dedicated board members. Over the past 8 weeks, your insights, time, and unwavering commitment have shaped the strategic plan at every level. Today, we are here not just to review a document, but to align around a shared vision that will position House of Hope as a transformative leader in recovery care. We began planning to strengthen House of Hope's long-term impact and sustainability. Our goal to ensure that every woman we serve has access to full spectrum of resources needed to re-enter society with dignity, stability, and hope. This journey was rooted in research, lived experience, and strategic foresight. Let me walk you through the process that brought us here. We used a multi-method research approach to ground our strategy in evidence and insight, qualitative and quantitative data from you, our clients, and our peers in the field. We conducted a formal needs assessment, gathering client survey data, conducting staff interviews, and conducting operational analysis. Here's what we found. Our counselors are overextended trying to help clients access external services despite not having the time, training, or tools to do so. Clients face confusing, inconsistent access to housing, employment, and healthcare resources. Most concerning, informal word of mouth referrals has been our default system. This was a wake up call. We realized that access to social services is a cornerstone of recovery, not an afterthought. It is time to eliminate fragmented support systems and institutionalize equitable access. Next, we conducted a sustainability matrix and categorized our programs into 4 areas. We have a keep and contain cost area, where our structured residential, outpatient, and sober living areas are located. We have an invest and grow area, where our housing capacity, therapy options, and a new initiative, our social services resource guide, fall under. We have a water and harvest area where our grants and pledges rest, and we also have a close or giveaway area where we placed our word of mouth resource systems that fail our clients. We also mapped out our priority mission impact criteria, which helped us rank what matters most, which would be 1, our contribution to our intended impact, 2, addressing our unmet needs, 3, our depth of programming, and 4, our scale and reach. Through our SWOT analysis, we identified our strengths, weaknesses, opportunities, and our threats. Our strengths include our passionate staff, comprehensive services, and community trust. Our weaknesses include our capacity limits, tech gaps, and underfunded therapy. Our opportunities include strategic partnerships, grant availability, and digital tools. And our threats include policy uncertainty, economic instability, and client housing insecurity. Based on all the analysis performed above, we learned from our clients and staff that a desperate need for housing beyond insurance limits is necessary. We have a significant gap in therapy access due to our limited staff. There's a client desire for life skills training and holistic care. And last but not least, we have a frustrated staff due to a lack of tools and time to connect clients to services. Our analysis also pointed to one overwhelming challenge: inequitable access to recovery services. This led us to define and review our priorities. We came up with 7 in total, which we then analyzed for desirability and feasibility of each. And from that, 3 strategic priorities emerged. 1, develop the social services resource guide. 2, license the guide to peer recovery centers. And 3, expand access to individualized therapy services. These strategies support our mission to empower women, align with our values of optimism, passion, empathy, diversity, and integrity, and build long-term sustainability. Finally, after identifying and prioritizing our top 3 strategies, we have created action plans to implement over the next 3 years. The first action plan centers on creating a social services resource guide. This will be our priority during year 1. This guide will centralize information on housing, employment, financial aid, and healthcare, bridging the gap for women in recovery. In the initial phase, we will create a digital document using internal knowledge and research. Our future vision consists of a real-time, interactive platform updated continuously. We will measure our success by tracking increased service utilization, reducing delays, and observing better recovery outcomes. The second action plan centers on licensing the resource guide to external recovery centers that lack their own formalized referral systems. This will turn a critical internal tool into an industry standard solution and a revenue engine, and it will be our priority for year 2. The licensing guide will serve as our revenue model, which we will use to provide a sustainable income for hiring additional therapists. Our pilot goal is to onboard 5 centers within 6 months. Support will be necessary. Therefore, we will be providing training modules and implementation guides. The quarterly adoptions, partner feedback, and annual outcomes will measure our success. The third action plan centers on expanding our therapy services. Relapse risk increases when clients lack individualized care. To meet this challenge, we will recruit additional licensed therapists, leveraging Medi-Cal reimbursements and guiding licensing revenue. We'll expand culturally competent, trauma-informed care, and we will measure our success by tracking session utilization, client outcomes, and therapist retention. This isn't just about therapy, but dignity, healing, and stability. Ladies, at the heart of these strategies is an analysis of power and privilege. Recovery should not be easier for those with wealth, access, or connections. The Social Services Resource Guide is designed to level the playing field and ensure that all women, regardless of background, have access to the support they deserve. This leads me to where this will take us. Let's imagine 3 years from now. House of Hope is a regional recovery hub offering therapy, housing, and integrated services. The Resource Guide is a nationally licensed tool that funds therapy for every client. We are advising other recovery centers, sharing our model of equity and sustainability. All of this is possible, and it starts with the choices we make today. These initiatives are more than goals. They are our commitment to sustainability, equity, and healing. The guide removes barriers. Licensing creates sustainability. Therapy expansion deepens recovery. Let's make this real. Your expertise is critical. Your passion is the engine. Together, we're not just building a strategic plan. We're redefining what recovery looks like. With that, I would like to thank you all for walking this path with us. House of Hope is more than a recovery center, it's a movement, and each of you is an essential part of that transformation. Thank you and have a nice evening.